our course. The title of our course is Pharmaceutical Dosage Form. Myself, Dr. Ujjwal Nautiyal, Associate Professor, Swami Rama Himalayan University, Department of Pharmaceutical Sciences, Jollygrant, Dehradun, Uttarakhand. This course is meant for undergraduate students of pharmacy, which gives understanding about pharmaceutical dosage form, or you can say dosage form available in pharmaceutical market or market. There are 9 lessons in our course. So without delay, let's start with the lesson number 1, which is introduction of pharmaceutical dosage form. In this lesson, we learn about what is the dosage form, classification of dosage form, why they are important for us, and why we need this type of dosage form or medicament, how they classify according to their route of administration and physical characteristics which are available in market.
So students, we will continue with the lesson number 1, pharmaceutical dosage form. So at first, dosage form. Dosage form are the means or form by which drug molecules are delivered to the site of action within the body. So medicines are administered in the human body through different route of administration depending on the method of absorption required for their therapeutic effect. Medicines reach to the target area to act through various type of dosage form. So here the question arises, what is the need for dosage form? Why we need to convert any drug into its dosage form? So some are need here: accurate dose, protection from gastric juice, making taste and odor, placement of drug within body tissues, sustained release medicament, control release medicament, optimum drug action, insertion into body cavities, and use of desired vehicle for insoluble drug. We will study, or we will understand, we will learn about these factors in next slide. Now the need for dosage form. At first, mechanism for safe and convenient delivery of accurate dose. By converting any drug into a suitable dosage form, we can give accurate dose to the patient according to their age and weight. Second, protection. Here, protection from atmosphere. So, by converting, some medicaments are hygroscopic in nature, which absorb water from the atmosphere and convert into a dump mass or in a liquid. So to avoid these type of incidents, we convert hygroscopic drug into the granules or encapsulated it into a capsule, or by giving them film coating, we can protect the drug from environment and inhibit its composition. Best example for drug protection from atmosphere is tablet coated tablet film coated tablet, film coated tablet. Here we give the coating of polymeric film into the tablet to avoid atmosphere degradation. Next is protection of drug from gastric acid. In other way, we protect medicament to release in gastric fluid where the effect desired in the intestine. So we give entry coating to the tablet which dissolve. This coating is dissolved into the pH of gastric mucosa. So when we desire the effect of any medicament into our colon or intestine, so we will give a coating which dissolve or which disintegrate into the environment of intestine. So we protect these type of medicament from gastric juice to release into the gastric juice. So we will give it into a anti coating. Next, uh, to avoid bitter and salty taste or offensive taste or odor. So here some medicament having bitter taste and odor, so these drugs are given in sugar coated tablet form or capsular form to mask the taste and odor and make them acceptable. So here we can say there is three type of protection which we give to our doses form. Protection from atmosphere by coating the tablets or by encapsulating into the capsule form. Next is protection from gastric acid. Here is the best example is anti-coated tablet. And next is protection from giving offensive odor and taste. Here we use the capsule dosage form, coating sugar coated dosage form, or flavoring them in, into a specific flavor. Next is provide liquid preparation of insoluble drug. Some drugs are insoluble in liquid or solvent, so we can add some agents like suspending agent or emulsing agent, co-solvent, which increase the solubility of medicament into the solvent. So best example is when drug is insoluble in liquid dosage form, yeah, or solvent, we can add other agent called suspending agent and prepare a acceptable dosage form which is suspension. Next is provide clear liquid dosage form. Some drugs are easily soluble in solvent such as water and hydroalcoholic solution, so we can give these dosage form directly into a liquid solution form. Next, provide rate control drug action. To avoid frequency of doses or increase patient compliance and to decrease chances of dose skipping, we can use sustained release dosage form. In this type of dosage form, drug release in a predetermined rate for a longer duration of time. There is no need to take doses frequently. Next is provide topical drug action. To give local effect and avoid gastric irritation, some drugs are given through topical route or you can say through skin. The examples are ointment, creams, patches, ophthalmic, otic and nasal formulation. Next is provide for insertion into body cavities. Sometimes patient is not in condition to swallow the tablets and capsule and direct and quick systemic effect are required. Then drug delivered through mucous membrane from different body cavities like rectal, vaginal cavities. So here we converted the drug or we can give the drug into the dosage form called suppositories. Next is provide for placement into bloodstream directly into the systemic circulation for immediate effect or immediate relief. Here the best example is uh, parenteral dosage form like intramuscular injection, IV injections, subcutaneous injection or all injectables are parenteral dosage form. Provide for inhalation therapy for nasal congestion, sinus or initial therapy is required. In addition, many dosage form permit ease of drug identification through distinctive color, shape, identifying marks. So you can say sometimes multiple medication therapy is required by patient. Many patients, particularly the elderly, take multiple medication daily. The more distinctive the size, shape, and color of solid dosage form, the easier it is the proper identification of medication. Error in taking medication among the elderly occur frequently because of their multiple drug therapy and impaired eyesight. Dosage form that allow reduced frequency of administration without sacrifice of efficiency are particularly advantageous. Need for different dosage form of same drug to minimize discomfort and instant relief and improve patient compliance. Here is an example. The age of the intended patient also play a role in dosage form design. For infants and children younger than 5 years of age, pharmaceutical liquid rather than solid dosage form preferred for oral administration. These liquids, which are flavored aqueous solution, syrup, suspension, are usually administered directly into the infant's child mouth by drop, spoon, or oral dispenser. Single liquid pediatric preparation may be used for infants and children of all ages, with the dose of drug varied by the volume administration. When a young patient have a productive cough or it vomiting, gagging, or simple rebellious, there may be some question as to how much of the medicine administered is actually swallowed and how much is expectorated. In such instant, injection may be required. Infant size suppository may also be employed, although drug absorption from the rectum is often erratic. How to solve the difficulty of swallowing, especially a solid dosage form? For this reason, some medications are formulated as chewable tablet. Many of these tablets are comparable in texture to an after dinner mints and break down into a pleasant tasting creamy material. So newly available tablet doses form dissolve in mouth in about 10 to 15 seconds. These allow the patient to take a tablet but actually swallow a liquid. Same as if we consider the capsule dosage form, if a capsule is moistened in the mouth before it is swallowed, it becomes slippery and readily slide down to the throat with water. Also, a teaspoonful of gelatin dessert, liquid candy, syrup placed in the mouth and partially swallowed before placing the solid dosage form in the mouth aids in swallowing them. Medications intended for the elderly are commonly formulated into a oral liquid or may be prepared into an oral liquid by pharmacists. However, certain tablets, capsules that are designed for controlled release should not be crushed or chewed because that would interfere with the integrity and intended performance. So, need for different doses form of same drug. Simple take the example of paracetamol. If we take paracetamol for a kids, so we will give it into a syrup, suspension, solution or liquid dosage form because kids are not comfortable to swallow a tablet or capsule dosage form. Same paracetamol, if we take, if we give it to a elderly patient, we will give solid dosage form like tablets or capsule form. Or if the patient is not in condition to swallow the tablets or we desire the action immediately, we give it into we give it by injectable dosage form. Now, desirable property of dosage form. Whatever the dosage form, some properties or some qualities are there should be. They are convenient to handle, use and store, stable during storage and use, withstand mechanical shock during transport, flexibility in different drug strength, provide expected therapeutic effect, extend drug release, onset, intensity, duration of action, predictable, economical, and elegant. These are some qualities which must be every dosage form have. Now come to the classification. Classification of pharmaceutical dosage form is based on four factors: physical state of dosage form, route of administration by which we give dosage form, site of application by where we apply or administer the dosage form, and uses where we use these type of dosage form. So come to the classification. At first, classification: solid, on the basis of physical state: solid, semi-solid, liquid and gas. Solid dosage form like unit solid dosage form, tablet and capsules, or bulk dosage form, powders dosage form or dusting powder. If we solid dosage form are the dosage form which are in which one or two medicaments are mixed together, combined together in dry state, which are compressed or non compressed, then it converted into the tablet dosage form. If they are encapsulated into a shell, it is comes under the capsule dosage form, or if they are given in a dry form, they are powder dosage form. Now semi solid dosage form, in which dosage form are cover, cream, paste, gel and suppositories. Next is liquid dosage form, monophasic liquid dosage form. Monophasic, that as name indicates, here is a only one phase of liquid or solvent. Biphasic, here is a two phase. Monophasic liquid dosage form: syrup, solutions, uh, waters, lotions are the monophasic dosage form. In biphasic dosage form, emulsion and suspension are there. Next is gaseous dosage form, inhaler or aerosols dosage form. This is the classification based on the physical nature or physical state. Next, based on route of administration. Route of administration means in which we will delivered or administered the dosage form. In which route we will deliver any dosage form. If we delivered by oral route, oral, by mouth, powders, tablets, capsules, solutions, suspension, emulsion, syrups, elixirs, magma, gels, catches and pills. These are dosage forms which are generally given by oral route. Next is second is parenteral route. Parenteral route, by injectables directly through the systemic circulation. Solution, suspension or emulsion are best example for parenteral preparation. Now rectal through anus. Suppository, enema and ointments are there. Urethral through urethra, suppositories. Next, sublingual, beneath, yeah, under the tongue, tablets and lozenges. Intra-respiratory through through nasal mucosa, these are aerosols, or through respiratory tract, aerosols given in the condition of asthma. Transdermal, on the skin, ointment, cream, powder, paste and lotion. Vaginal, through vaginal cavities, suppositories, tablets, ointment, cream, dosage. Intranasal, through nasal cavities, solution, spray and inhalations. Conjunctiva, through eyes, ointments and drops are also there. And intraocular intraocular through eyes, solution, suspension and ointment. Now, according to the site of application, where we are applying the dosage form, where we using the dosage form. First is skin. Skin, when we apply dosage form into the skin, these are ointment, creams, lotion and liniments. Eye, solution, ointment and creams. Tooth powder, toothpaste. Hands cream, lotion and hand washing liquid. Foot cream, ointment and dusting powder. Hair cream, hair lotion, shampoo and hair fixing. Nasal solutions, spray and inhalation. Uses, according to uses, they are classified internal or external use. Internal, all preparation except external are internal. External preparations: ointment, lotion, creams, powder, solution, liniment, paste, hair dyes, hair colorant. Those are used our external body. These are the classification of pharmaceutical dosage form. So, general consideration in dosage form design. Before formulating a drug substances into a dosage form, the desired product type must be determined. Then various initial formulations of the product are developed and examined for desired features. The formulation that best meet the goal for the product is selected to be master formula. Before medicinal agents, in formulating into one or more dosage form, among the factor consideration are such therapeutic matters are the nature of illness, the manner in which it is treated, the age and anticipated condition of the patient. So, drug substances are seldom administered alone, rather they are given as part of a formulation in combination with one or more non-medical agents that serve varied and specialized pharmaceutical formulation. Selective use of these non-medical agents referred to a pharmaceutical ingredients or excipients produces dosage form of various type. The proper design and formulation of dosage form require consideration of physical, chemical and biological characteristics of all the drug substances and pharmaceutical ingredients to be used in fabricating the products. Second, the drug and pharmaceutical material must be compatible with each other to produce a drug product that is stable, effective, attractive, easy to administer and safe. The product should be manufactured with appropriate measure of quality control and packaged in container that should be labeled to promote correct use and be stored under conditions that contribute the maximum shelf life. So that's all about pharmaceutical dosage form, why we need pharmaceutical dosage form, classification of dosage form according to site of action, uses based on their physical nature and based on route of administration, and why and the facts we considered before manufacturing or formulating any pharmaceutical dosage form. For this for today, this is enough. Thank you.
So dear all, I hope you all understand about the pharmaceutical dosage form very well, and you know about the importance of pharmaceutical dosage form. In our next video, we will study our chapter number 2, which is solid dosage form. Till then, enjoy, take care and keep learning. Thank you.